Hi, I'm Pfotenhauer. I'm the Dean for Career Education and Economic Development at Cabrillo, but I also chair a consortium of 26 colleges in the greater San Francisco Bay Area. About 10 years ago, I had the experience of going to a high-tech organization in Silicon Valley and asking their support for a program that we had at our college. And the vice president there basically laughed at us and said, "We're a pretty large business. We employ people all over the San Francisco Bay Area, and we cannot figure out how to engage with the community college system. There are so many of you, and you're all organized so differently. Come back and speak to us when you can speak to us as a system." I've thought a lot about that since then, and one of the things that we've been doing in the Bay Area is bringing the colleges together to begin working at a regional level rather than college by college. Most recently, we've been doing this in healthcare, and we found that there's quite a different dynamic that occurs with employers when we can sit down with them with 26 colleges and say, we together are your human capital supply chain. And working together, we can really do some powerful things for you. When we have that kind of organization and that ability to work at scale, big employers like Kaiser, the Sutter system, big public health organizations are quite interested in working with us. And that, I think, is really a key to how do we do what matters, how do we deliver what matters for jobs in the economy, leveraging our scale. And we can do that. We're the largest post-secondary system in the country. We've really barely begun to tap the scale that we have. Joining together in networks really allows us to have that scale and to deliver to employers what they need, which is a network of colleges that can deliver a variety of courses and programs in ways and in places that they need it. One of the things that we have been doing to give priority to what matters is tracking whether our students are actually getting employed and whether they're getting employed in the industry for which they've prepared. An example of that would be our medical assisting program. Looking at our Perkins data, we saw that our medical assisting program had about a 95% job placement rate. But when we looked at the actual data that we were getting back from our students, we found that a much smaller percentage of them were finding work in the industry for which they were being trained, that is, as medical assistants. That led to some discussions with employers about why that might be, and we found that from the talks with employers that they really needed our students to have much stronger basic skills, particularly in the areas of math and English. That led also to looking at labor market information, and we realized that probably between our program and the programs at the adult school and at the regional occupational program, we were putting too many students out into the marketplace. Consequently, we reduced the size of that program, went to a cohort-based structure, and created a bridge semester which focused on giving students contextualized instruction in both math and English. We increased our retention rate. We think we'll increase our placement rate significantly. This is, we're just starting our second year of this program. But I think it's really an example of how getting good data about what student outcomes are can really help you focus on what matters for jobs in the economy. We were able to find out that our students weren't getting jobs in the ways that we thought they were, and able to make the adjustments to our program through dialogue with the employers that really made that program much stronger and made it a much better investment for the state and for our students. One of the ways in which Cabrillo College has been giving priority to what matters is by engaging in pretty rich dialogue with our employers. For about 10 years now, we've been convening something called the Health Careers Partnership, which brings together all of the employers in healthcare in our region, along with all of the other providers of workforce development. That would include the Regional Occupational Program, the adult schools, the Workforce Investment Board, the Employment Development Department, a variety of people that all together are trying to meet this particular industry's needs. We found that it's particularly powerful for employers, for all the workforce development stakeholders, when we all come together on a regular basis. Out of that, employers have identified needs each year that they are wishing for help with. Over the 10 years, we've done things like increased our nursing program by 50%, retooled our medical assisting program, developed a number of contract education programs that meet employers' particular and specific needs, developed stackable skill certificates that allow people to move from one occupation up to the next. Those kinds of dialogues with employers are really powerful, and they're made possible when you bring all the stakeholders together, not just a single college, but multiple colleges, not just education, but also workforce investment boards, employment development department, getting all of those players in the same room really creates a very powerful dynamic that works to the advantage of our students, to our employers, and to education.